1.7 million Texans at risk, understanding the impact of ACA changes. Imagine a scenario where 1.7 million Texans could lose their health insurance due to upcoming changes to the Affordable Care Act. This stark reality highlights the significant impact that policy shifts can have on public health and financial stability. But here's where it gets controversial. These changes, primarily stemming from a Republican tax and spending bill, threaten to undo much of the progress made in expanding health coverage in Texas. Sign up for the brief, https://www.texastribune.news//the brief/New.York/Newsletters/the brief/tribune marketing and from Line CDA brief, the Texas Tribune's daily newsletter, to stay informed on the latest developments affecting Texans. In Washington, health policy experts predict that up to 1.7 million Texans could lose their health insurance as a result of these changes. This is particularly concerning given that Texas already has the highest uninsured rate in the nation, straining its healthcare system even further. This year, nearly 4 million Texans enrolled in ACA health plans, marking a record high for the ACA marketplace, which has been operational for 12 years. However, the expiration of enhanced premium tax credits, introduced during the Biden administration to make health insurance more affordable, combined with the new Republican legislation, poses a significant threat. These factors are expected to drive up the number of uninsured Texans, leading to higher premiums, increased financial burden on hospitals, and instability in the insurance market. Texas stands out among states because it has not expanded Medicaid to cover individuals earning above the federal poverty level, unlike 40 other states. Consequently, the ACA marketplace has been crucial in providing health insurance to lower-income residents. Since the ACA's implementation, Texas' uninsured rate has dropped from 23.7% in 2010 to 17.4% in 2023, largely thanks to ACA enrollment. Among the nearly 4 million Texans currently enrolled in ACA plans, approximately 2.5 million fall within the 100 to 150% federal poverty level range, which translates to $32,150 to $48,225 annually for a family of 4. This group includes individuals who would otherwise qualify for Medicaid in states that have expanded the program. In Texas, however, Medicaid eligibility is limited to children in certain low-income, adults with specific conditions or circumstances. Cynthia Cox, director of the program on the ACA at KFF, a nonprofit health policy organization, emphasized the severity of these impending changes. She drew a parallel to the Great Recession, when many lost job-based health insurance, but noted that the upcoming ACA changes could be even more impactful. One major concern is the new bureaucratic hurdles introduced by the Republican bill. Automatic plan renewals will end, and there will be more stringent income documentation requirements. Additionally, the open enrollment period will be shortened to just 1 month, and year-round enrollment will cease for individuals earning under 150% of the federal poverty level, starting in 2026. Moreover, certain lawfully present immigrants, including DACA recipients and refugees, will no longer be able to obtain insurance through the ACA marketplace. These changes will disproportionately affect Texans who rely on the ACA for coverage, with 95% claiming a sliding scale premium subsidy in 2025. According to the Centers for Medicare and Medicaid, over 1.4 million enrollees, or 36%, had their plans automatically renewed. Supporters of the Republican bill argue that these measures aim to eliminate waste, fraud, and abuse in the ACA marketplace and reduce unsustainable federal spending. They believe that more frequent documentation and verification processes will ensure that taxpayer funds are used effectively. However, healthcare researchers warn that these changes could exacerbate health disparities. Lynn Cowles, the Health and Food Justice Director at Every Texan, a progressive think tank, criticized the bill for its intent to undermine health programs by discouraging enrollment. KFF projects that the ACA changes will result in 560,000 Texans losing coverage. The primary cause of coverage loss, however, is the expiration of enhanced premium tax credits at the end of 2025. Without these credits, premiums for many Texans could skyrocket, particularly for those in the lower income bracket. The Center for Budget and Policy Priorities estimates that someone earning $22,000 annually might see their monthly premium increase from $0 to $63. For those earning over 400% of the poverty level, premiums could triple. KFF projects an average premium increase of 115%, or $456 annually, for ACA enrollees using tax credits. These increases could price many Texans out of the insurance market, leading to a cycle of rising premiums and reduced coverage options. Blue Cross Blue Shield of Texas, the state's largest insurer, has requested a 21% rate increase for ACA-compliant individual plans for the next year. As these changes loom, the future of healthcare access in Texas remains uncertain. Will Congress find a way to extend the enhanced premium tax credits? Or will millions of Texans face the harsh reality of losing their health insurance? Your thoughts and opinions are valuable. Please share them in the comments. 1.7 million Texans at risk of losing health coverage. What you need to know. Are 1.7 million Texans really at risk of losing their health insurance? This is a pressing issue worth exploring. In a landmark year, around 4 million Texans enrolled in Affordable Care Act, ACA, health plans, marking the highest participation since the initiative launched 12 years ago. Yet, health policy experts warn that changes resulting from a recently enacted Republican tax and spending bill could jeopardize coverage for as many as 1.7 million residents. The stakes are incredibly high, particularly in Texas, which possesses the largest population of uninsured individuals in the United States, as highlighted by the Texas Tribune. This year has certainly seen a surge in signups, but with the expiration of premium discounts introduced during the Biden administration, coupled with the alterations instigated by the new GOP legislation, Texas may face a significant uptick in its uninsured rate. As a corollary, experts speculate that this situation could also lead to higher insurance costs overall, an increase in unpaid medical bills, and a cascade of complications throughout the health insurance landscape. Interestingly, Texas has opted not to expand Medicaid, unlike about 40 other states. This decision has compelled many lower-income individuals to rely on the ACA for their health insurance needs. As a result, the uninsured rate in Texas dropped from approximately 24% in 2010 to 17% in 2023, primarily due to the enrollment success achieved through the ACA. Out of the 4 million Texans who signed up for ACA plans this year, around 2.5 million have incomes ranging from $32,150 to $48,225 for a family of 4, just a hair above the poverty threshold. In Medicaid expanding states, individuals in this income bracket would typically qualify for Medicaid, but in Texas, the ACA has helped bridge this gap. A significant portion of Medicaid beneficiaries in Texas comprises children. However, for low-income adults, qualifying for Medicaid can be challenging. Generally, they must meet specific criteria, such as being pregnant, disabled, over the age of 65, or a parent with a monthly income below $300 for a family of 4. Cynthia Cox, a researcher at the nonprofit organization KFF, suggests that the repercussions of these recent changes could lead to the most substantial decline in insurance coverage seen since the ACA became law. In her words, "I recall the Great Recession, where countless individuals lost their jobs and subsequent access to employer-based health insurance. This scenario could surpass that crisis." Now let's talk about the projection that around 200,000 Texans may lose their Medicaid benefits. Much of the dialogue surrounding the Republican tax and spending bill has focused on cuts to Medicaid, especially concerning new work requirements. However, since Texas never expanded Medicaid, the impact will likely be less severe here than in numerous other states. The KFF estimates suggest that the number of Texans losing Medicaid coverage will be comparatively low. What will likely hit Texan residents more acutely are the adjustments to the ACA marketplace. This legislation complicates enrollment, discontinuing automatic renewals, requiring additional paperwork to demonstrate income, and shortening the open enrollment period to merely 1 month. Beginning in 2026, individuals earning below 150% of the federal poverty line will no longer have the option to enroll year-round. Moreover, this bill also restricts healthcare access for certain immigrant groups, including DACA recipients, refugees, those holding temporary protected status, and asylees, thereby limiting their ability to obtain ACA marketplace insurance. Currently, most Texans utilizing marketplace plans are receiving assistance with their premiums. In 2025, it is projected that 95% of these individuals will benefit from income-based tax credits to help alleviate their monthly expenses. Furthermore, over 1.4 million, which equates to roughly 36%, have had their plans automatically renewed, according to data from the Centers for Medicare and Medicaid. As these developments unfold, the conversation about the sustainability of coverage for many Texans continues. How do you feel about the potential ramifications of these legislative changes? Are they fair or necessary? Share your thoughts below.